Good morning student. We will continue our topic of hemoglobin. Subtopic is catabolism of heme. As all of us know, hemoglobin is present in RBCs. Old and damaged RBCs are hemolyzed in reticuloendothelial cell like spleen, liver, bone marrow and macrophages, mainly in the spleen. Spleen is also called as graveyard of RBCs. Large number of RBCs are old and damaged RBCs are destructed in the spleen. When there is hemolysis of RBC, hemoglobin comes out. This hemoglobin is broken down into heme and globin. Globin means alpha globin and beta globin chains. These globin chains are made up of protein, so they get converted into amino acid, and these amino acids are added to amino acid pool. Now the heme get converted into bilirubin with the help of enzyme heme oxygenase system. This heme oxygenase system requires coenzyme NADPH, which supplies 2 hydrogen atom for this reaction. This reaction also requires molecular oxygen O2, and carbon atom is removed from heme in the form of carbon monoxide. So biliverdin is formed. Now this biliverdin is reduced to bilirubin with the help of enzyme biliverdin reductase. Biliverdin is green color, whereas bilirubin is having yellow color. So this is the structural difference between biliverdin and bilirubin. See, in biliverdin there is a double bond between third and fourth pyrrole ring, but due to addition of 2 hydrogen atoms by NADPH, that double bond between third and fourth pyrrole ring is saturated and it becomes yellow color bilirubin. When heme is catabolized, the iron which is present in the heme is removed. It gets converted into ferric form, and that ferric form is taken up by a protein called as transferrin. In this way, the catabolism of hemoglobin takes place. The end product is bilirubin, and this is formed in reticuloendothelial system, mainly in the spleen. So bilirubin is formed in the spleen mostly. Daily about 300 milligram of bilirubin is formed per day, out of which 250 milligram of bilirubin is formed by the breakdown of human RBCs, and 50 milligram of bilirubin is formed from myoglobin and other heme containing proteins. Now bilirubin has no function in the body. The body will excrete bilirubin outside through the bile in liver. But bilirubin which is formed is in the reticuloendothelial system. First, this bilirubin has to be transported to the liver for its excretion. This bilirubin is insoluble in water. Therefore, it cannot be easily transported in the blood. Insoluble bilirubin is also called as unconjugated bilirubin or indirect bilirubin. It is insoluble in water, but it is lipophilic. Now this unconjugated bilirubin or insoluble bilirubin combines with albumin. Albumin is a protein which is hydrophilic, and now this albumin transport this unconjugated bilirubin from spleen to liver. One molecule of albumin can bind with 2 molecules of bilirubin. In general, 100 ml of plasma can transport up to 25 milligram of bilirubin. Now, when this albumin bilirubin complex goes to the liver or reaches the liver, the bilirubin is taken up by the liver cells. This uptake of bilirubin by the liver cell is carrier mediated and active process. the binding between albumin and bilirubin is in loose combination. So bilirubin can easily be dissociated from albumin. Drugs like aspirin, penicillin also binds with albumin. When such drugs are taken, they displace the bilirubin from albumin, and thus unconjugated bilirubin is not transported to the liver for its excretion. As I have told you, this unconjugated bilirubin is lipophilic. It easily diffuses into the cell, or it can easily crosses the cell membrane, which is made up of phospholipid bilayer. So unconjugated bilirubin enters inside the cell, and when this unconjugated bilirubin enters in the brain, the condition is called as kernicterus. It is mainly seen in newborn babies. Now some reasoning question is there. Aspirin is avoided in newborn babies. Give reason. Just now I have explained. This aspirin binds with albumin and displaces the bilirubin from the albumin binding site, and hence unconjugated bilirubin is not transported to the liver for excretion. It gets accumulated in the body, and hence aspirin should be avoided in the newborn babies, because the chances of crossing this unconjugated bilirubin to the blood-brain barrier and entering into the brain, leading to kernicterus, is more. Now, when this bilirubin, unconjugated bilirubin, enters inside the liver cell, just now we have seen, this bilirubin is conjugated with 2 molecules of glucuronic acid to make it water soluble. Glucuronic acid is donated by UDP glucuronic acid. UDP is a nucleotide. Now this UDP glucuronic acid donates glucuronic acid to unconjugated bilirubin to form bilirubin monoglucuronide. The enzyme is UDP glucuronyl transferase. Now this bilirubin monoglucuronide combines with one more UDP glucuronic acid to form bilirubin diglucuronide. That means 2 molecules of glucuronic acid are added to the bilirubin. Glucuronic acid is a water soluble substance. So after binding with the glucuronic acid, the bilirubin also becomes water soluble. This bilirubin now is called as conjugated bilirubin, water soluble bilirubin, or direct bilirubin. Here it is given that glucuronic acid binds with the propionic acid present on the heme. If you remember the heme structure, 2 propionyl groups are present on 3rd and 4th pyrrole ring. So this glucuronic acid binds with this propionic acid. Now 80% of bilirubin, conjugated bilirubin, is in the diglucuronide form, and 20% is in the monoglucuronide form. After conjugation, bilirubin becomes water soluble, and it is called as conjugated or direct bilirubin, that I have already explained. Now clinical importance. Some drugs like primaquine, which is a anti-malaria drug, novobiocin, it is antibiotic, chloramphenicol, again antibiotic, androgens like testosterone, pregnenolone, that is also a steroid hormone. These drugs interfere with the conjugation. This step. These drugs interfere with conjugation and hampers the conversion of unconjugated bilirubin into conjugated bilirubin. Therefore, intake of these drugs leads to increase in the concentration of unconjugated bilirubin in the body. So question is also given here, which type of bilirubin is increased? In the above case, the unconjugated bilirubin level is increased because the conjugation process is hampered. Now the water soluble conjugated bilirubin is excreted into the bile by active process. Why active process? Because in the bile the concentration of bilirubin is more as compared to bilirubin inside the liver cells. So they have to pump the bilirubin in the bile, which has more concentration, that is against the concentration gradient. So it requires energy, therefore this process is active, and it is the rate limiting step of heme catabolism. Rate limiting step means generally it is a slow step. Now a drug called phenobarbital, if given, it causes or it increases the excretion of conjugated bilirubin into the bile. Small amount of bilirubin is also excreted in the bile. Now bilirubin and biliverdin are called as bile pigments because they give color to the bile. Bilirubin has yellow color and biliverdin has green color. Out of these two, bilirubin is the major bile pigment in the bile. Now through the bile, this bilirubin enters into the small intestine. If you know the anatomy of biliary tree starts from liver and opens into the second part of duodenum. So bile enters into the duodenum. Along with bile, conjugated bilirubin also enters into the duodenum. From duodenum it goes to the jejunum, ileum and large intestine. In the large intestine, intestinal bacterial flora is present. This intestinal bacterial flora deconjugate the conjugated bilirubin. That means the glucuronic acid which are added are removed by the bacterial flora, and the compound which is formed is called as bilinogens. There are various types of bilinogens like urobilinogen, mesobilinogen and stercobilinogen. Immediately after deconjugation of bilirubin, the free bilirubin is reduced to a colorless bilinogen called as urobilinogen. Now this urobilinogen is further reduced by intestinal bacteria into mesobilinogen, which is further reduced to stercobilinogen. Now this stercobilinogen is mostly excreted through the feces and it gives brown color to the feces. Now 20% of urobilinogen is reabsorbed from the intestine and returned to the liver by hepatic portal vein. This circulation is called as enterohepatic circulation. It is shown here. So here I have shown liver. Liver excrete conjugated bilirubin which enters into the small intestine. From small intestine it goes to large intestine. In the large intestine it is converted into various types of bilinogens, and lastly stercobilinogen is formed. That stercobilinogen is excreted into the stool, which on exposure to oxygen get converted to stercobilin. Now in that process, small amount of urobilinogen from large intestine is absorbed by the portal veins. All of us know that this portal vein opens into the liver. So bilirubin goes to the urobilinogen goes to the liver and again excreted by the liver through the bile. This type of circulation is called as entero means intestine hepatic circulation. So from intestine urobilinogen is reabsorbed by portal vein, goes to the liver again excrete that urobilinogen through the bile, again comes to the large intestine. Now during this enterohepatic circulation, small amount of urobilinogen escape from the portal vein and enters into the systemic circulation. Through the systemic circulation it goes to the kidney, and through the kidney, in the kidney it gets filtered and excreted into the urine. When it is exposed to the oxygen, this urobilinogen is converted into urobilin, which gives pale yellow color to the urine. So this is about the enterohepatic circulation. Now differences between unconjugated and conjugated bilirubin. Unconjugated bilirubin insoluble in water, whereas conjugated bilirubin is soluble in water. Both bilirubins are soluble in alcohol. Normal level of unconjugated bilirubin ranges from 0.2 to 0.6 mg per deciliter, whereas conjugated bilirubin level is from 0 to 0.2 mg per deciliter. Unconjugated bilirubin is absent in the bile, whereas conjugated bilirubin is present in the bile, because conjugated bilirubin is water soluble, so it is excreted through the bile. If it is insoluble in water, it is not excreted into the bile. Next, in the urine also it is not present unconjugated bilirubin because it is not soluble in water, but conjugated bilirubin is normally absent. But when bilirubin level is increases in jaundice, conjugated bilirubin is also present in the urine. Now, diffusion in the tissues. Diffusion in the tissues means entering into the cells. Unconjugated bilirubin is not soluble in water. It is a lipophilic. Therefore, it can cross the phospholipid bilayer of the cell membrane and enter inside the cell. Whereas conjugated bilirubin is water soluble, it cannot enter inside the cell. Now, test for detection of unconjugated bilirubin is indirect Vandenberg test and direct Vandenberg test detect the conjugated bilirubin. Again, a case is there if intestinal flora is decreased by prolonged administration of antibiotics, bilirubin is not reduced to bilinogen, and in the large gut this bilirubin is reoxidized to biliverdin, and this biliverdin is excreted into the stool. It gives green color to the feces, especially in children. Now the question is causes of green color stools in the small children. First is due to bacterial infection, there is increased peristalsis movement, and second is due to destruction of intestinal flora. The bilirubin which is reaching the large intestine is not converted into bilinogens, various bilinogens like urobilinogen, stercobilinogen, mesobilinogen, and hence this bilirubin get oxidized back to biliverdin which has green color, and this is due to destruction of bacterial flora by antibiotics. Normal plasma bilirubin, total plasma bilirubin ranges from 0.2 to 0.8 mg per deciliter, out of which unconjugated bilirubin is about 0.2 to 0.6 mg per deciliter, while conjugated bilirubin is only 0 to 0.2 mg per deciliter. If the plasma bilirubin level exceeds 1 mg per deciliter, it is called as hyperbilirubinemia. The level of bilirubin between 1 to 2 mg per deciliter is called as latent jaundice. When the bilirubin level increases above 2 mg per deciliter, it gets diffused into the tissues, especially unconjugated bilirubin, and it gives yellowish discoloration of sclera, conjunctiva, skin and mucous membrane, leading to jaundice. So jaundice means yellowish discoloration of skin and mucous membrane, whereas hyperbilirubinemia means increase in bilirubin above 1 mg per deciliter. Sometimes for this jaundice the term icterus is used, which is a Greek word meaning jaundice. This is the Vandenberg test for estimation, quantitative estimation of bilirubin. As I have told you, two types of tests are there: direct Vandenberg test and indirect Vandenberg test. In direct Vandenberg test, conjugated bilirubin directly combines with azo reagent and form a purple color azo pigment at pH 5. In indirect Vandenberg test, unconjugated bilirubin when combines with diazo reagent, no color is formed. But when we add alcohol to this, you will get purple color diazo pigment. So conjugated bilirubin gives direct purple color by adding the diazo reagent. Therefore conjugated bilirubin is called as direct bilirubin, whereas unconjugated bilirubin will give purple color azo pigment after addition of alcohol, not after addition of diazo reagent, but after addition of alcohol it gives purple color. Hence it is called as indirect bilirubin. This is because direct bilirubin or conjugated bilirubin is soluble in water, so it combines with diazo reagent, whereas unconjugated bilirubin is insoluble in water. It does not combine with diazo reagent because it is insoluble. But when we add alcohol, this unconjugated bilirubin becomes soluble and combines with diazo reagent to give purple color. Now these are some tests for urine. If you want to detect bilirubin in urine, you have to perform Fauchett's test. If you have to perform urobilinogen in urine, you have to perform Ehrlich's test. For urobilin and stercobilin, you have to perform Schindler's test. So this is about the catabolism of heme. Thank you very much.